And thanks for joining us here on PM Express. This is Wednesday, so it's time for Manifesto Tracker. Last week, we started with governance. This week, we are looking at health, the big health debate, and it's there on your screen. And guess who is with me? Co-hosting tonight. You've heard him talk and talk quite a lot. Now he is here with me as a co-host. He's changing the shoe a bit. He'll be asking me questions. I'll be asking him questions. That's what co-hosts do. And we're going to be going through our slides. He's Kwame Saponasio. Do you know him? He's a fellow at the CDD. And you remember, and this is doing a full 360. A few months back, before the manifestos came out, we were here with him. And he gave us the health manifesto. And that, in essence, was to say, this is what it will take for the manifestos of the two main parties to be responsive, to actually address the real needs of Ghanaians. And we laid out what the template should be. Any manifesto that really delivers on your expectations must do a few things. And so we did that. We come back now to measure, after the manifesto has been put out, whether they indeed delivered on those key points. And that is why we are having this conversation. Two parts of the show tonight. We're going to have our analysis and measure the two manifestos against some benchmark, and we'll tell you which manifesto is closest to delivering on those key benchmarks. And then after that, we'll sit for what promises to be a very interesting interrogation of those two parties on the back of what we will learn from here. So stay with me. Don't go anywhere. 1 hour, 30 minutes here on PMS. It's always brought to you by Syntex Tanks. It is strong. It is tough. It is also brought to you by Academic Times and Pepsodent Cavity toothpaste. Now, the Academic Times Ghana is an incoming graphic and online publication aiming to collaborate with university authorities and students to ensure that student research is published in summary form. Of course, you know about Syntex Tanks. You need to get ready for the biggest giveaway from Syntex Tank. Syntex is giving away 15 communities free water. And this is to say thank you, Ghana, for making us #1. Now, if you are a community and you want to benefit from Syntex free water giveaway, just log on to our social media handles at Syntex Ghana. Nominate your community. Syntex Tanks, are strong, are tough. And you know, Pepsodent is what I use, and I recommend it to you too, because every time we eat food and sugars, we have stuff trapped in our teeth. You need that to clear that. It's very effective. I recommend that to you tonight. Let's come back to that, talking about health. Let's do right now that big health debate. And Kwame, when you were here the last time, we focused on this number 4 point here. And these are the benchmarks. Explain to me why these are important to measure any policy document or proposal by.
Well, okay, I'll start with the strategic development goals. Obviously, that is a United Nations, WHO benchmark to keep the societies as healthy as possible. And as part of delivering the SDG 3 is the universal health coverage, which essentially says health should be free at the point of use. It doesn't mean procurement of healthcare would be free, but at the point of use, finance should not be a barrier to you getting access to healthcare. And we have a target of delivering that by 2030. We're voting in 2024. The next government takes over in 2025 and would be in place for 4 years. So if by 2029 that government hasn't set us on the right track to deliver UHC, then we've missed the plot. And that is why it's important. But then coming to the health manifesto, obviously the government puts out documentations like the holistic health assessment of health program of works. They put out things like the health harmonization report, and the Ghana Statistical Service puts out reports on health as well, like the demographic health survey. They all identify gaps in our health system. And so what we're saying is, if the government is paying money for all these reports to come out, then anyone seeking to govern us should try to address those gaps in the official documents. And that was why we put out the health manifesto. The question now is, having received these manifestos and having churned through them, are they addressing what our government tells us are limitations? For example, if you look at the health harmonization report, it says 95% of our consultation rooms do not have the full complement of equipment. It's a government document.
Yes, the question is the manifesto delivering on that. Because the fundamental question we ask on Manifesto Tracker is, if you propose a solution, a policy, it must address a need.
Yes.
It must address a need. You can't just be saying it because it wins you votes.
No.
It must speak to some particular need. And you say, we have spent money to actually map out what our problems are. And so definitely tell us
how you're going to fix it.
So that's what you're measuring that by.
That's basically what this should be.
Okay, good, good. But you left out my favorite. I don't think you sort of talked about fiscal feasibility.
You see,
I say it's my favorite. I'll tell you why. Because really, Kwame, before we start, I said to you, I think this year, more than any other time in our electoral history, fiscal feasibility is the single most important question or factor in how realistic any policy is.
Well, yes, and I deliberately skipped it, and I'll tell you why. I did so because...
You're teasing me here.
Yeah, I did so because we are the IMF looking for $3 billion.
Yeah.
So if you give me anything, that is 50% of that $3 billion that you tend to implement, you need to show me how you're going to do it. Because if we cannot find $3 billion locally, you tell me anything, you find anything above 1.5 billion in a year, you are selling me snake oil, basically. And that is what I'm, yes.
That's important. And that's why I wanted to emphasize that point. And so please pay attention as we go on. We'll be measuring them by this. And in the end, we'll ask that all-important question: how are you funding it? Because remember, 2025, a lot of the renegotiated, restructured debt will come into play. Very important. The economy will have to pay a lot. And so you need to now pay attention to, do you have the money to do so? So let's start with preventive healthcare alignment. You say any effective, responsive manifesto must deliver on 3 big things under preventive healthcare.
Yes.
1, prevention, health promotion, and then intervention.
It must, because health is behavioral. If you have a system where people seek healthcare when they are unwell, the system is not functioning properly. The system should be designed to identify the walking unwell, those who do not know that they have the diabetes, the hypertensions of these worlds. And the system should identify them early so that it can keep them healthy for as long as possible, and in technical terms, delay their getting into secondary, tertiary, and quaternary care, where cost of healthcare is more expensive. So if it's not delivering on prevention, it is not because it's not doing health promotion, because the promotion is what changes the healthcare seeking behaviors. So if the healthcare seeking behaviors are not changing, then you are not going to achieve prevention. And if you don't achieve that, then you cannot intervene, because if you don't identify the people who are walking around who are otherwise unwell but don't know, how do you intervene to keep them healthy for as long as possible? And that is why it has to deliver on all.
And so the question then becomes, which of the 2 parties on the subject of preventive healthcare deliver on prevention, health promotion, intervention in terms of their proposals for 2025 and beyond? And these are, in essence, a summary of what the 2 parties broadly say they will do on this subject. Let's start with the MPP. MPP says they plan to expand the wellness clinics for screenings and health promotion.
Yes.
What's your assessment on that? And by the way, this is in contrast with the NDC. Yeah. They say free primary health care. They're also promising comprehensive health screenings, targeting cervical, prostate, breast cancer, etc., but also public health education on healthy lifestyles. I believe they are all doing a good job.
Well, you see, the NDC has been more detailed, because if you, at the previous slide, you realize I talked about the prevention and health promotion. And one of the things that I said was that you need to identify them as early as possible. And one of the identification interventions is screening. Okay. Because when you screen, then you find. When you find, then you can manage. When you manage, then you have better prognosis.
And I see the word there, screening?
Yes. And you see screening here. But they have gone forward to identify some of the chronic conditions that are becoming a bugbear for our health system, like cervical cancer, prostate cancer, and breast cancer. For example, in the UK, for example, you don't see cervical cancer now because there's a vaccine for it, the human papilloma vaccine. And I can tell you that some of their medical students do not see cervical cancer unless they bring them to sub-Saharan Africa to see cases. That's how effective the vaccine has been. The question is, which of these 2 are going to provide a vaccine, for example, cervical cancer for the young generation? How are they going to screen for it and all that? More importantly, how are they going to pay for it? So if you look at expansiveness, then the NDC expands more on the preventative aspects of our healthcare than the NPP, because the NPP is saying they are just going to expand on the wellness clinics. The wellness clinics have been in operation for quite some time now. I'm not too sure how many people are aware of them. which means health promotion has failed. Because if they've been in existence and they're a good thing to be in existence, but if you don't know of them, how are you going to access them? And so they need to tell us more as to how they are going to promote these and how it's going to plug into delivering on preventative health.
And I need to isolate something. I think one of the biggest line items in the NDC one is the free primary health care. That's a big, big one.
Yeah. You see, I'm shelving, and that was why, if you remember, I said that I was going off the fiscal.
We'll come there. Just a comment there, because I know we have a whole slide on this.
You see, let's look at it this way. Free primary health care has been delivered in certain countries. The benchmark countries who have delivered it properly are Brazil, Indonesia, and Malaysia. If you look at all the data, it's to deliver it, the per capita is between $40 and $60 per person per year. The average is $50 per person per year. So if you look at that, you multiply 50 by 34 million, which is the current projected population of Ghana, you're talking about 1.7 billion. That's why I said I'll shelf it for now.
Yeah.
Because then we will get to the conversation. We are looking for.
I think what we're saying on this matter is that, on this subject, is that yes, it is a good must-have.
It is excellent, but how are we going to fund
it? We'll come to that. We'll come to that. And so the verdict is that, of course, the NDC on this subject is more expansive.
Yes.
Than the MPP on the subject of preventive health care. Now, let's look at the health financing. And this is a big deal. It all comes down to
money.
And you see the big number on your screen, 15%. That is what the Abuja Declaration we committed to, because we signed on to this.
Yes.
To say that we'll increase our health spending by 15%. Where are we now as a country?
Well, we signed up this in 2001 under former President Kufuor. We are 23 years down the line. None of the governments that we've had, both NDC and MPP, have done about 5.8%. I always say benchmark 6%.
That's significantly lower.
Yes, they've not done it. And you see, that is the disrespect sometimes political parties show the citizenry. We sign these declarations, we have fanfare, and we have no intention to go by them. And why do they do so? Because they know that at the end of the day, the citizenry just want a wish list, so they can publish something in their manifestos, and we'll just buy into them.
We are not going to allow that to happen. That's what we are doing.
Yes. But the point is, why we need to ask them, why haven't we met the Abuja Declaration? And if we haven't met it and don't intend to meet it, then why don't we delist from it and say we are no longer signatories to this and come up with realistic targets that we can meet for our health financing? And that is a big question that needs to be answered by.
It needs to be answered. The question is, did the manifesto answer this? Did the manifestos answer the question? Let's find out. And you immediately begin to just come to that conclusion that both sides, as if this doesn't exist.
No.
As if this doesn't exist. But there's a reason why 15% was chosen.
Yes.
And if you recall, when we did that manifesto tracker here, manifesto, the health manifesto here, the various
health
professionals who were on the show were demanding this. In fact, I think the Nurses and Midwifery Association, they wanted even more. They wanted at least 20%.
Yes, and I did tell them that was infeasible.
Yes, you said that was not possible.
Yeah, it was infeasible because if we were not doing anywhere close to the 15%, I would be practical and say at least let's try 10% and then take it from there. But like you rightly said,
they had an opportunity, both sides, to now address it in their manifestos.
Yeah. And you see, and that is what I talk about, the disrespect, because the political parties also listened to the health manifesto. They knew what the professional bodies were talking about. These are the practitioners in the field.
And we learned that day, all of them had met the manifesto drafting
and they said they had told them this.
Yes.
And yet they are both silent.
And by the way, the two gentlemen joining us after this were all part of drafting the health manifesto for parties.
Yes.
Dr. Nsiansari, he heard from the health professionals associations that we want this.
Yes.
And also Titus Berrio, who until recently was a general secretary of the GMA, also heard so. And yet when they drafted it, they were silent.
And that tells you they have no intention to meet it. And that for me is a big red herring. I tell you why. Because even with the current funding, the fiscal space in our health budgets are so constrained that there is no money for CAPEX and there's no money for health research. A lot of our research is internationally funded. And yet they are silent on this. That gives me a concern that do they really intend to implement what they've put in these manifestos?
That's a very, very
because they are not expanding the fiscal space in the health sector. And for me, that is something we should.
So what did they say they will do instead? The MPP says they will amend the NHI Act, NHI's reimbursement adjustments too, because that, of course, we know will bring in a bit more money. Question is, when they say amend, what would they have instead?
No, it wouldn't. It wouldn't. You see, if you say it would bring a bit of money, I have a concern and a challenge. There. The act is clear as to the monies that they've taken. They decided to cap it. So that is not amending.
Yeah.
You are actually sticking to the act. That's not amending.
And okay, that's what the NDC is saying here, that they do decollateralize the NHIS levy.
Yes, but then the question I would ask the NDC as well is, if you decollateralize it, you are going to have a gap in the consolidated fund. How are they going to plug that gap?
That's a very important point.
You see, and that's why I'm saying that it's all leveraged on the fiscal space and the fiscal constraints we have under an IMF program.
And we are saying that the constraint that will be tighter in the next 4 years, whoever wins.
Yes, and already there's no space. Yet they are lamping on promises as we go along, so they still need to tell us how they're going.
But at least the NDC said they'll create a fund. They'll create this medical care trust fund.
Yes, that's a brilliant idea. Many countries have it. It would help with things like, the renal dialysis and a lot of these cancers that are coming up. But I still need to know, how are you going to capitalize it?
That's a point.
And you see, so yes, you say brilliant idea, but show me the numbers.
That's a very important point, Kwame. Let's talk about human resources for health. And I'm pretty sure you've heard the conversation around brain drain. The doctors are leaving in droves, the nurses too. So Kwame says, if you really want to tackle this particular challenge, you must expand training. Because as they go, you have to somehow replace.
Yes.
Right? So you have to train. And then you say, yeah, they have to now retain what you have. So you have to do both at the same time.
Yeah.
And we are not going to ask the question. Did both parties address this?
You see, and I'd ask a caveat here. Just as the Abuja Declaration, there's also the Kampala Declaration, which was signed in 2008 as to how to retain healthcare workers. Again, it was signed. We do not comply with the Kampala Declaration. The irony was that the review of the Kampala Declaration in 2009 was done in Ghana in March 2009. By then, the Kufuor government had left who signed it. The NDC were the ones who did the review. But since then, both parties have not complied with the Kampala Declaration. And that is what I mean by we enjoy this fanfare of signing up to things with no intention of sticking to them. And that is why I said we should benchmark all these things to what we actually have signed ourselves up to.
Okay, so let's measure. Let's measure now what they do, both sides. MPP says they plan to recruit more healthcare professionals and incentivize for rural workers. So part of the second bid is attempting to do the question of retention, right? Because if you're incentivizing, then you possibly then will retain some who will be happy with what incentives you decide to put in, correct?
Yes.
So that's one. And then they talk about recruits. So they're going to bring us more health professionals,
yes.
The MPP, right? But I'm asking whether expand training is not necessarily there, right? Well, when you recruit, obviously you're training. Is that what you mean?
You see,
does that address that point?
I've always had this school of thought that health is a science as well as a vocation. And the tricky thing about vocation is your skills improve as you get more experience. So when you lose your experienced human resource in a vocation, the risk to the general public goes up because the backfill doesn't have the same vocational tiredness that the people who have left have. And that is why training is good, but retention is key because the vocational skills are what decreases the mortalities and morbidities when people are treating in the healthcare. The NPP is very silent about it. I don't see much about it in the NDC manifesto. I get this impression when I read from both parties that they have an idea of what they want to do, but they are not too sure as to how to go about it. Because the tricky here is the pull factors that are pulling the health professionals abroad have a lot of remunerative advantages that, truth be told, we cannot match. And that is why documents like the Kampala Declaration were clear about certain things we can do to actually mitigate against these pull factors. They are silent on that, and that is why a lot of the things that they need to talk about if they talk about them, some of us who know about the Kampala Declaration say, well, these things have been in existence in 2008. You reviewed it in 2009. You've not done it till 2024. What makes you think that putting it into a political party manifesto is going to make it happen? And that is why I think they're silent about it.
I mean, I find it fascinating, considering the conversations we've had on this particular subject. Both the Ghana Medical Association, the nurses have said, it's a big problem, and we had this conversation 1,000 times here. And yet, the manifestos, that guiding document for the next 4 years, are, even if they're touching on it, they're not as detailed as to what exactly they're going to do about the problem. That is worrying indeed.
Well, yes, because the detail is in the numbers. If you say you are going to resource somebody, it's about money. Meanwhile, you are not meeting the 15% target. So if the money is not, and that's why they need to show us where the money is.
We'll talk about the money primarily very shortly. Access to essential medicines is very important. The thing we are measuring them by, we want to see a manifesto that emphasizes the Pareto principle. What is this?
Basically, the Pareto principle is 80% of your disease burden should be managed primarily by 20% of your generic medication. If you look strictly at pharmacy, it's just an 80% to 20 ratio. But more importantly in healthcare, that 20% you should have control over, like either their manufacture, their procurement and all other things. So you need to incentivize your local pharmaceutical industry to at least identify these 20% and have control over their production. Which of the two manifestos is living up to this expectation?
Let's find out. So you have the NDC saying they will support local pharmaceutical production and integration of traditional medicine. Does that do this for you?
Well, yes. I mean, in a way, it supports them. But support them to manufacture what? Support them in what way? What money are you putting? Because the support should be financially backed. What money are you putting there? So I like the language, but I don't see the intent. And for me, that is what's key. And you look at the NPP and they say, plan to make Ghana a regional hub. And I ask myself, you've been in government for 8 years.
But didn't they do something on the back of the COVID crisis? They turned it into an opportunity and created
you listen to the pharmaceutical society when the vice president was on the, health manifesto. Yeah. You heard what he said. I don't want to sound like a broken record, but after 8 years, if that is what a government has done, then it's woefully inadequate. Because, and you see, the litmus test for the viewer is the cost of pharmaceuticals when you go and buy out of pocket from your pharmacy shops. If they are going up more than your wages are increasing and is affecting your management of chronic diseases, then you have to know that whatever intervention was put in place hasn't worked.
That's a fascinating point. And so on this particular subject, access to essential medicines, which of these two parties is closer to dealing with it for you? Well,
if you say you would make Ghana the West African hub, then the assumption is Ghana will be self-sufficient in its production of the 20% by the Pareto principle. So in that sense, I would say the MPP is being more ambitious in saying that we'll make it. So by default, they are saying, as for Ghana, sorted. Our target is West Africa. And West Africa would then bring in foreign exchange, which would then help us stabilize the cost of medicines locally because they would be buying in Forex. The NDC says support the local pharmaceutical industry. Now, what I see the NDC saying is get your home sorted first before you start thinking about the sub-region. See? So ambition, give it to the MPP when it comes to that. Practicality, give it to the NDC. Because if they've done it after 8 years and still the cost of medicines are going up, then the strategy hasn't worked and they need to explain to us what they are going to do differently for it to work.
We're helping you make up your minds about who to vote for on December 7th, and it's simply looking at the facts. And let's look at the gaps in the mental health. And I like the fact that you isolated it, but this is something that we often don't talk about.
Yes.
But you say it's an important part of this entire health system that must be addressed by the parties. And you say to do this, they must expand their mental health service allocation by 5% of the health expenditure.
Globally, with countries who have taken healthcare seriously, 5% of their health expenditure is focused directly on mental health. The truth of the matter is, if you look at all documentation, they'll tell you between 1 in 4 and 1 in 5 of us at any point in time experiences a mental health episode. The unfortunate thing is, when you talk about a mental health episode, people think that it has to be synonymous with you being naked and walking on the streets and all that. The reality is it's not that. Things like stress are mental health issues.
You're right.
Depression are mental health issues. We come from a society where we ignore some of these things until someone is breaking down. Because we cannot fund mental health properly. If you look at our budgets, less than 1% of our health expenditure has always been...
It's a neglected area.
It's a neglected area. And we need to stop and get better.
And so the MPP there says a little emphasis on mental health completely, right? But you have that NDC that says, they mentions increasing access to mental health care and establishing the facilities, but lacks funding commitment, which is a running theme through all this.
So you're going to do all these. So if you look at it that you expand access, then the assumption is that you're going to have maybe mental health nurses in community settings available to CHIPS compounds and other things. Already we are not incentivizing the health professionals to stay in these areas. So how are you going to do that? And for me, that's
an important point. And the health infrastructure, which is a big deal. And if you listen to the MPP, they're talking about Agenda 111. That's fundamentally health infrastructure, right? But we say to really be to have a responsive manifesto, you have to complete abundant health projects first. And then you expand rural infrastructure. So those are the two key things, self-explanatory. Which of the two parties is close?
You see, health infrastructure is a very difficult one for me, and I'll tell you why. Because in 2020, when all this Agenda 111 came out, I was on one of your programs, and I said that if by 4 years, the NPP, and I'm quite sure you remember, has been able to build and operationalize 20% of those Agenda 111, I would cast my vote for them. And I made it a cast
So for you, that was the single most important issue that will influence who you vote for?
Yes. I said if they could do operational... We are virtually at the end of October. I tell you, they wouldn't be able to commission and operationalize even 1%.
Thankfully, the man who is...
because you see, the problem is commissioning and operationalizing
are two different things.
Operationalizing means you have doctors, nurses, pharmacists, and patients.
And I can tell myself in tomorrow if I'm ill into that hospital and expect to be treated.
Because the thing about health is that the funding is an input. So Agenda 111 is an input. It has to get an output, which is patients attending, then lead to an outcome, which is improved quality of health, longevity of the people, improve access to healthcare, and then ultimately the outcome, increase life expectancy, increase quality adjusted health years. I don't see any of the Agenda 111 projects delivering that before we cast a single ballot.
Yeah, but the MPP says in their manifesto, this is simply highlighting the past projects that have been done. And I know they'll talk about the Agenda 111, definitely, but lacks the clear future proposals. I mean, they, I guess, believe they've done a lot in terms of infrastructure, but they haven't delivered on, I guess, the big ticket item of Agenda 111. The NDC, though, if they win, they must, as you say, first complete Agenda 111 projects.
No, because, you see, there's something about health called the sunk cost value, and it happens once you've sunk money into a project, that money is stuck in the project. You have the situation like what happened in Konfanoche, where a maternity block was left for about 40, 50 years. That's a sunk cost. We still have to pay for it anyway. So it's either you finish it or you scrap it. So for me, you need to take a bold decision there as to what you're going to do moving forward. Whether you're going to save excess sunk cost or you're going to finish it and operationalize.
There's something interesting that I see in the NDC one. They will complete the CHIPS compound. The CHIPS compound is an initiative they introduced, right?
And they are silent on the Agenda 111. And that's why I talk about the sunk cost effect. There need to be bold decisions, and people need to be clear. And our politicians also need to tell us there's governance is a continuum. So if the NDC are now coming to tell us they are going to complete the CHIPS compound, are they insinuating that the MPP over the last 8 years have abandoned the CHIPS compound? And by default, are they also insinuating that they are going to do the same to the Agenda 111?
That's a very important question we'll ask them. But we're saying that, in essence, these two parties, on delivering on these 2 points, where would you put them? Where will you rate?
I think they are there's no clarity there.
Okay, and we need the clarity. And then we talk about the pathway to the universal healthcare. MPP focuses more on the infrastructure and HIS reforms. You have the NDC emphasizing expanding access, improving health financing, and strengthening primary care services. And so, where are you?
You see, like I said,
towards a clear pathway.
if you talk about on paper pathway, clearly it's the NDC. And I've told you and I've explained why, because with this free primary health care, you are increasing access. People can get it for free. But if you have a pathway that you cannot pay for, there's no comparison.
And it ties into this
slide
here, because obviously they are more comprehensive in what they are proposing.
Exactly the point I'm making.
111 promises in law and health alone.
But have they been costed?
That's an important point.
You see, the point is, globally, if like in the UK, for example, by now the Institute of Fiscal Studies would have costed these manifestos, would have come out and said to implement the NDC part of the health manifesto is going to cost this, to implement the MPP.
You've done that.
Yes, we've done that.
We'll come to that.
Yes.
But so you see the MPP one is 52 promises. NDC is very extensive. And the question needs to be asked of both of them. How are you going to fund 111 proposals in a manifesto?
Yes, especially when you are fiscally constrained.
Absolutely.
And you see, that's my biggest concern, that till now, since their manifestos came out, no one has put any numbers out, not just in health, but anywhere.
They are watching us. In the next few minutes, they will join us. You know I'm going to ask you that question, so you better come with the numbers. And if you don't tell me the numbers that will convince him, we'll return and do an analysis on many of our other shows of mine tomorrow, because they'll put out the numbers and we'll interrogate that. Now, let's complete pretty shortly. And we look at the 2020 Health Manifesto Tracker. We're looking at some of the big ticket items that both parties are looking at in terms of the MPP recruitment. We've talked about the doctors. We've emphasized that. They also talk about bringing healthcare services to your doorstep. We've talked about that. We looked at the MPP. There's 5 top big ticket items. They also offer incentives for one healthcare worker, one vehicle. You know, that's something that they propose for the healthcare workers. That's the incentives they're talking about, hoping that would ground them here and not get them to run away, because you know you're going to have that from government. Also amend the NHI Act to establish what they call the separate health insurance regulatory body. I don't know what solution they are attempting to sort of put forward, and what are they really solving with this?
Because if you have a regulator separate from the NHI, the authority, then they can see to fairness and equity and things like when the capping happened, is the law being complied with and all that. So I agree with that in principle, that we would need a health regulator, especially with other insurance companies coming into the health space.
Okay, so that's what you're doing that. And then you have the 5 big ticket items for the NDC. We talk about the decollateralizing the National Health Insurance Scheme already. They talk about the review and the integration of the mental health into primary health care. Something you touched about, that the NDC's manifesto is more responsive on that issue than the MPP's. And then you look at the development of a health worker integration policy framework to facilitate ethical migration, whatever that is. They need to tell us, how do you define ethical migration?
That has a definition in the Kampala Declaration, but I'll leave it to them to.
Okay, they'll tell us what their definition is pretty shortly. Remove the taxes and tariffs on vaccine and medical donations to public health facilities. And this comes on the back, I remember, of the dialysis conversation that we had. That
and
got
also
a lot
the vaccines and medicines that got stuck in
Temaport for a very long time. Even when they gave it to us for free, we couldn't clear them.
Yeah.
So that's an issue. Now, we're going to the big area for me. First, we want to look at the budgetary allocation over the period, right? Comparing NDC and MPP periods, because it's all about track record on the subject. In 2009 and then 2006, we just picked 2 points to look at this. Of course, after the 2008 elections, at that time, it was 0.921, right?
Yeah.
And then we are talking about 2016, 4.9 billion.
Yeah.
That's an increase, right? It's 432% rise. So that's good. NDC comes in, MPP comes in at 4.2 billion, but now we are talking about, in the last budget that was read, 15.6 billion. What's your comment on this?
You see, comparing these numbers absolutely is a bit of a struggle, because you have to factor in the exchange rate at the time, and that's why health expenditure per capita is always quoted in the United States. So I tend to like to look at what's the health expenditure per capita currently and what are the health expenditure per capita track records. If you look at it, the highest health expenditure per capita Ghana has had was $111 to $113 per person per year, which was in 2015, and it was under the NDC. Currently, we are hovering around $93, $94 per person per year. The reason why that equates to 15.6 billion is because the dollar is about 16 cedis now, compared to a dollar that was about 4 or 5 cedis in 2016.
It's possible that you could have done more with 4.9 billion.
And apart from that, our population growth rate is 2.1%. It's slowed down a bit to 2.1%. It was 2.2% then. So you have to factor all those in. And that is why, to level them all up, I look at the per capita. And if I look at the per capita, you'd realize that, and anyone can go and check it because it's on the WHO website, you realize that the NDC were consistent with the per capita. The NPP have been spiking and dropping. At a point, they dropped to $67. They've come up to almost $100 now, which is a good thing. But it blows it up to that figure, not because they are putting more money in dollar terms, especially when 80 to 85% of our health system is dollar indexed, but because our money has collapsed.
That's a important point. Now to the big picture for me. So you, as CDD, costed the manifestos. Something that we don't do, but you have taken time to put this together for us to appreciate what is going to cost the MPP and the NDC to implement their manifestos. Yes. And you've said, for the NDC, with their 111 promises, they're going to cost them $18.5 billion.
Yes.
That's jaw-dropping for 4 years.
For 4 years. So if you divide it, it's about $4.5 billion a year. And you have to factor it in that a chunk is the earlier calculation I made of the free primary health care because of the $50 average with 34 million people. So that is there. Even if in our calculation, what we did was we assumed that, let's say that they are going to even, only 50% of Ghanaians are going to access that. So the 1.7 billion just comes to about $850 million. But that is still a lot of money a year to find.
Yeah.
Factoring in the fact that we need to find 3 billion and we are struggling and going cap in hand to the World Bank. So for me, they have to tell me. And one thing about numbers is when you tell them every time, what the political parties would do is to try and muddy the waters by saying, how did you come to this? I'm not going to play that game with them. What they should tell us, how much is it going to cost? If they say that is wrong, let's assume they came and said all this is wrong.
They should tell us.
They should tell us how much.
Because you put it up. You tell us how much it's going to cost.
Yes, and if they want to see the numbers and what has gone into the modeling to get to this, I'm prepared to share. But most importantly, they should tell us how it costs. The NPPs would cost
13.9.
Yeah.
They are more realistic in what they are promising. You saw in the numbers there.
Even then, it's about 3.9 billion per year. They can't find 3 billion.
Yeah.
But then they are telling me that they will find 3.9 billion every year over 4 years. When they can't find, when they can't find 3 billion for
3 years,
for 1 year from the IMF.
IMF, yes.
Just to get.
I mean, the point
support.
you're making, we've gone to the IMF, wanting 3 billion
for the whole country
over a 3-year period.
Which is 1 billion a year.
And now you say you're going to be spending 3 billion every year for 4 years.
4 years. So what I get is, as happens with a lot of our manifestos, it's a wish list. They would implement some of them irrespective of who wins power. But 4 years from now, we probably would be looking at the things they promised us that they never implemented. And that, for me, is what we are trying to prevent today. By them opening up to us, telling us where they're going to find the money from, looking at our budget deficit as per November, what they were telling us, the gap in our budget, and show us where the money is going to come from.
Especially at the time of economic crisis, as has been projected, it's probably going to take us a decade to recover. How are you going to find $18.5 billion for the NDC, $13.9 billion for the MPP to fund that manifesto over the 4-year period? You only have a 4-year mandate, and don't let them tell you, 8 years. This is a 4-year mandate, and that promise, because in 2028, we expect them to come up with a new manifesto.
Yeah, they would.
So we are restricting them to the 4 years.
Unless, of course, something like the NPP is going to do, because now Agenda 111, which was in the 2020 manifesto, is now carrying forward into the 2024 manifesto, which means that they are expecting to fund over the 8-year period. If that is what they have to do, they also need to be upfront with us.
And tell us.
And tell us.
Because
absolutely. The manifesto, as far as we're concerned, is for a 4-year period.
We're going to take a break now. When I return, Kwame Sabasedu, of course, is going to take leave, but Dr. Nsiasari is going to join me. Titus Bayo is going to join me. We're going to tilt them, the hard questions that we have raised, with our smart wall here to them. Stay with me. And thanks for staying with me. We're done with the first part. We've analyzed. My guests are now seated for a conversation. Dr. Anthony Nsiah-Asare is the presidential advisor on health and MPP Manifesto spokesperson on that same sector. We have Titus Bayo, Professor Titus Bayo, NDC parliamentary candidate, Lambusi, and Manifesto spokesperson on health. I didn't know you're a professor now. Yeah. Good. Congratulations. Congratulations.
Thank you.
I just know you as Dr. Titus Bayo. Congratulations indeed.
Thank you.
You know, so good to have you in the studios having this conversation. Then I want to start with the biggest part of the conversation we had analysis, and it is about the costing of the manifesto. Dr. Nsiah, let me start with you, Dr. Nsiah-Asare. Have you costed your manifesto? First, give me your reaction first to our verdict on some of the key parts of both of your manifestos, including mainly your own manifesto.
Yeah, thank you very much, and good evening to our cherished listeners and viewers. Yes, I watch you, and I've realized that there are some aspects of our manifesto that you didn't even highlight. I mean, you look at some aspects of, for example, health, disease control, health prevention. There were some aspects that you didn't come out clearly, which I will expatiate later on. And we have written our manifesto. We know what has gone into the manifesto. We look at things like what has happened, what happened in 2020 to the whole world. That's COVID-19. So in preparing our manifesto, we took advantage of that, and we said that we have to be proactive as a country, especially because of the pandemics which are coming. And we have anything that we are doing in health, you have to look at the health prevention, health promotion, health education, early detection, and then treatment, and making sure that the threat is not overwhelming, and then look at the health infrastructure security of the country so that you prepare yourself. And doing all these things, we believe that you do things and do it better when you stand on the pillars of technology. So that is the main aspect of our manifesto. So if you look at the manifesto per se, you realize that we took it step by step to make sure that we prepare ourselves adequately as a country and make sure that our health infrastructure security is very solid, to make sure that the human resources are also well trained and adequate, continue training and retraining and recruitment and retaining our scarce health professionals, and you look at all aspects of health systems to make sure both, we have the infrastructure across the country, because I always put that we have about a 5-tier system in the health service.
Let's start with that infrastructure question, because it's a big one. It's a big one. Coming into this manifesto,
yes,
your biggest infrastructure intervention was Agenda 111.
Yes.
Which you haven't finished.
Which is very unique in the whole world.
It's not about uniqueness. It is about its delivery.
Yes, it's
right.
It's delivery.
But you haven't delivered a single one.
We will deliver some before His Excellency the President leaves power.
I take note that in your manifesto you said that you will complete all Agenda 111 projects. Okay. As we speak tonight,
yes,
this is a project that was in your 2020 manifesto.
Yes.
Right? You have failed to do it.
We haven't failed to do it. I disagree with you.
Okay, so what?
When somebody fails,
but you haven't commissioned one.
If you fail to do,
none is operational.
No, if you fail to do something, it means you have completely abandoned them.
Not necessarily.
That is failure to do it.
The promise was to build and operate.
Yes, we are building.
But you're not operating.
Building is not over a day. Building is not over a day. There's a history in this country which we are not even like that. So we've started Agenda 111, which is 111 hospitals, 101 district hospitals, 3 psychiatric hospitals, and then 7 district hospitals and rehabilitation of Ifekwanta Hospital. We are starting it throughout the country. The region with the least number of Agenda 111 is 2 district hospitals and 1 maybe one.
As we speak tonight, what's the status of the project?
As you speak tonight, I can conveniently tell you because I have been, actually, it's in my office. We are managing it. 100 of the 111 Agenda 111 hospitals are operational. They are.
When you say operational, what do you mean?
It's under construction.
Okay.
Okay, operational, okay, maybe I will draw that. Operational means that we finish and we are working in it. You start a project, you have to look for the land, you have to look for that the land has no issues. So as we speak, 98 of the district hospitals are at various stages of construction. Some of them above 90%.
But Dr. Nsansari, I've been hearing you say various stages of completion for at least 3 years.
Various stages of completion, not for 3 years.
So when are you completing even one?
We will come out and tell you very soon when the president is going to commission the first few that we have finished.
Very soon. The president has less than 2 months.
Yes, you can. I mean, he has less than 2 months.
Well, let's say
So
2
you can-
months. Let's say 2 months.
So if
because he has November, December,
if for
and
example,
really his life,
if
his
yes,
term
but
is
2 months
expires.
is a long period for somebody to finish a project.
So you're saying that you will commission and operationalize some of the Agenda 111 hospitals before he exits.
Yes.
When
I
exactly?
can confirm that.
When exactly?
It will start, and you all be in this country. You see the numbers as.
How many will he operationalize?
We are going around, finding out in the regions which ones can be operational, completed, commissioned, and then put into operation before the president leaves office at the midnight of the 6th of January 2025.
Are you saying that as we speak tonight on the 30th of October, you're not certain which of the hospitals you can operationalize in the next 2 months?
I'm very certain. I'm certain.
I can tell which one?
I can tell you in confidence that there are some of the hospitals about. You see, I've told you about 100 of them have 100 of
various
them,
stages of completion. I've heard
various
that.
stages of completion. Yeah. Some of them are about 95%, 96%. We are going around the regions. I've been to Upper East. I've been to Upper West. I've been to Northeast, Northern region. I've been to Eastern region, Western region, Central region. We are here to move into. I have been to Ashanti region, but we'll go there again in Ashanti region to see the numbers that will come out. And they will be in Volta region, OT, and they will complete Bruno East and Bruno West, Bruno East Ahafo, and then also at Western North. We will then come out and tell you that this week, this day, His Excellency the President will go to this site and go and commission.
How many will you commission? Do you plan to commission before he exits in the next 2 months?
I won't give you the number now because I know
you don't know.
I know.
So tell us.
No, I know because I haven't completed going around to find out which ones will be added on the numbers that we.
And as we said, commissioning is not operationalizing. So how many will you then operationalize?
Commissioning and operationalization commissioning have to come first.
Yes.
Or sometimes you can operationalize it before you even commission.
That's true.
But you want the president to
because of the political season, yes. You want to gain the political capital from
political
that. That's fine.
Capital after it. He envisioned this, and he has to commission at least.
How many will you operationalize?
We are hoping that whatever we commission, we operationalize it immediately. We commission it.
And Titus, we noted in your manifesto that you say you plan to complete CHIPS compound. It's very clear, and he admits that they can't finish Agenda 111.
We can't finish all Agenda 111.
You can't finish Agenda 111.
All Agenda 111.
Yeah. As of tonight, you can't tell me how many you're going to be commissioning. So I can't even say for certain.
Okay, let me tell you something.
Operationalize any.
Let me tell you something. Out of the 100 that we have at various stages of completion, 33 of them are above 70% completion. And potentially, all those above 70% can finish within a very short period because most of the work have been done.
All those above 70%, you're confident
you can finish to finish. But there are
in 2 months.
Some of them which are 90%, 95%, which I'm very certain in my mind that we can finish within the next 2 months.
So how many of those are 90%?
I'll tell you very soon.
Okay, so back to the question I was asking. It's obvious they can't finish Agenda 111. Question to you, as we highlighted, is...
No, I think you have to correct it. We can't finish all Agenda
111. No problem. Do you commit to finish them if you win on December 7th?
A very good evening, Evans. and a good evening to our viewers, and thank you for having us. I think that His Excellency, our incoming President, John Dramani Mahama, has made a public commitment that he's going to try to complete abandoned projects. What we cannot commit to, we cannot make that categorical statement that we can finish all these Agenda 111 hospitals, because the people who even propounded the concept have changed their dates severally. Evans, the honest truth is that the whole concept of this Agenda 111 is shrouded in lack of transparency, that for someone to make that commitment, you need some information. This is the first time that we are having hospital constructions being managed from the office of the president, not the Ministry of Health. And you are journalists, you can go find out. You get no information of this from the Ministry of Health. He just admitted that this is being managed from the office of the president, under the chief of staff or wherever it is. It's in the office of the president.
But that doesn't matter.
It does matter.
If we can operationalize,
no, it does matter.
Operationalize it,
it does matter.
Does it matter who's managing it?
No. Because I'm saying that because of the question you asked. For me to commit that we can complete these hospitals, we need to be able to publicly assess the contracting processes that have gone through, the costing and the funding mechanisms in place, and what has been done before you can say. I hope you get what I'm trying to say. His Excellency is very conscious of the kind of health system we are going to be inheriting. He has made a public commitment that he intends to complete abandoned projects. That is undeniable. What we cannot say is how many of them we can complete, because we need information. You need to assess what has been done, right? We are hearing here about 30% above 70% completion, or 30 of them are above 70.
33 of them.
33 of them, about 70% completion. Evans, completing a hospital, the physical structure is different from operationalization, as you have stated. Equipping the hospital is a completely different ballgame. Now, staffing the hospital and getting it to work is another thing. Right from the instance where they introduced this whole concept of Agenda 111, I kept asking some fundamental questions. What is their human resource policy and mechanism of staffing this? So you are going to ambitiously complete 111 hospitals, some specialist hospitals in different parts of this country. These human resource needs cannot be generated overnight. You know, on the average, how long it takes to train a doctor. You know, on the average, how long it takes to train a nurse and to train a specialist. So we should see a deliberate human resource policy. Because I'm bringing in this additional health infrastructure, I'm increasing admissions into medical school by this factor, or am I expanding access here?
The 2024 manifesto we just analyzed, the MPP commits to increase training of health professionals.
So this is the contrast. This is a government that has plagued our health system with quotas and caps, right? And I can explain that to you. If you take nursing, they have placed a quota on nursing admission, right? Because they made a political promise to maintain nursing allowances. And so some of the nursing schools are admitting like 30% of their capacity. So what do you mean by increasing access?
But they said they'll
so you don't
recruitment. Recruitment is going to be an issue for them.
We'll come to the recruitment question. When I was coming to this studio, some allied health professionals sent me a message and said, Titus, please talk about this for us. Since 2019, all those allied health professionals that have graduated from 2019, after completion of their services, none have been recruited.
What's your policy on that?
So,
because we said when we're analyzing that for your manifesto to be responsive, you have to commit to expand training.
Yes.
Retain healthcare workers.
Yes.
They say clearly that they plan to recruit more health professionals. We'll ask them the specifics shortly. But in your case,
so we have committed directly that we are going to expand training. How are we expanding training? We do not believe in the quota system. We think that we have to remove that quota. Qualified people should be able to gain access to training, right? And that was the concept initially when we were talking about that we needed to have a national discussion on this allowance. You cannot use the allowance to limit the number of people that go into training. in the milieu where we are having an exodus of a lot of healthcare workers. So you need to train more. We are mindful of the migration, and we are saying we are coming up with a migration policy that would ensure ethical migration.
What is that?
And this is stated clearly in our
What's
manifesto.
ethical migration?
So when people are leaving your country, currently what is happening, it's unethical. We are having the most skilled professionals leaving. After all their training, these are people you even trained on allowances, and they leave with no recompense to the government, to the country. The private agencies that facilitate their migration are paid sign-on fees, and the country gets nothing. So we are saying that we need to come up with a policy. People who need to go out, countries that need the services of our people, can we deliberately train and export? And there is some financial arrangement to support further training, right? That is ethical. If you are using our human resource trained with our taxpayers' money, there should be some arrangement. You don't leave it an
The
open.
countries needing our health professionals will pay the government to have them.
Of course, we can have that arrangement where if you are picking them through and if the migration is controlled, because you see the challenge is that, and I've been saying there's been a shift in the goalposts. In the earlier part, people living these countries were young doctors, young nurses in search of education. That is not the situation anymore. You are seeing consultants, specialists, highly qualified, critical care nurses, anesthetists. These are the people leaving. Several years of experience that cannot be easily replaced by new people that you've trained. So when such people leave and you hire them, can there be a policy where you compensate the country of where these people have come from? And as I'm telling you, I trace the migration trajectory for people who go to the UK. And I can tell you some of the sign-on fees that even agents that work for them get. But because these people leave on the blind side of the country, in other words, they get their clearance from the Nursing and Midwifery Council, get the clearance from everyone sure they don't owe anybody. Sometimes they owe the banks, that is not seen, and they move.
So who makes the payment? Is it the health professional or the country?
No.
The destination?
When they go there, the country needing them, the trust needing them, pay for this. In the earlier part, they would even give you tickets for yourself, for your spouse, for your kids, because they need you to come out. But this is all happening on the blind side of our government. So we have stated clearly that we need to have an ethical migration policy on that. We have talked about expansion. And when you come to the expansion of training, the critical thing is that don't put on quotas. Allow people to train.
Why do you have quotas, Dr. Mensah? Sorry, I'll come
So,
back to you.
but you see, we want to come
I'll
to
come back to you. I'll come back to you.
Okay.
I'll come to you.
When you are done, then
Why do you
I'll
have
tell you
quotas
about a few
on
things
your-
of how to
Why do you
motivate
have
them.
quotas?
Yeah.
Evans, even in the university, it's not everybody who qualifies for the university who enters the university. If you have aggregated, it says you've qualified. Nursing and medical or health professional training is both didactic and practicals. You can't say that, okay, you can take 1,000 students in a classroom. I've seen some before when I was the Director General of Ghana Health Service, where I went and saw a nursing training school for about 1,000 people in a community center of the lecturer holding a microphone teaching. That is not training. You have to get first them learn in the classroom and then go out to hospitals to go and do practicals. So it's very important. That's the reason why we've put up a lot of hospitals and everything.
But you commit your manifesto to improve recruitment. How are you
Yes.
going to do it? With your cap?
First, I'm going to tell you something. He's saying that we didn't think about human resources for Agenda 111. It's not true.
Okay.
We have a complete comprehensive plan for the number of people who will be working in all our hospitals. For district hospital, we have about 550 people who will be working, health professionals. This excludes other workers who will be joining them. In the teaching hospitals, we have about 1,379. If you go to the psychiatric hospitals, we have about 930 people. So in all, it's about nearly 70,000 people will be working. We've drawn this plan with the Ministry of Health.
70,000.
Yes.
Where are you getting the 70,000?
For nurses, we have some nurses who are at home. Their nursing training schools have increased the numbers in the nursing training schools who are coming out. So we are going to employ all of them. So Agenda 111.
And the doctors?
The doctors, there are doctors in this country that we can also use. And
How? Where?
The medical
Where are they?
schools have
You
increased.
talk about 70,000
No, 70,000 health professionals.
professionals in all.
Health
How many
professionals.
doctors?
I can tell you the number of doctors.
Yes.
Come here, let me open my this and I tell you, give you
Evans,
the
while he's opening that,
right figures.
let me just give you some evidence to what I was saying. You see, let me give you a letter dated on the 18th of July 2022. The principal, Nursing Training College, I'll omit the situation. Quota for 2022 academic year. The Ministry of Health has announced the distribution of quota.
He hasn't disputed it, actually.
No, I'm coming. And then when I talk about this quota, he's talking about, and this school was given the maximum that they can take. We are not saying the quota, we are not saying everybody that qualifies. We are looking at the capacity of the school to train. This is a school, in this particular school, if I give you the details,
Can I go?
they were allowed to admit less than 50% of their previous capacities that they were training, right? So it means that they have the laboratory infrastructure, they have the clinical space to do all their, they've been training that number, and to maintain the pure
What
reason.
quality, though? They've been training in the past, but with what quality?
Good quality, because we've not doubted the quality since the beginning.
No, I mean, you can't say that.
No.
You must be measuring that.
And I'm saying
you may be
so-
putting out quantity instead of quality.
Evans,
So,
do we have
it's not about quantity.
objectively
So, Evans-
proving? And we have a way of proving that.
Yeah.
After that, they write a national licensing exam. They should show us the evidence that when the school previously trained, say, 100 people or 200 people, what was their pass rate? And then you've dropped that to 30% of the school's capacity. Why? Why? You get my point. So, look, let's be very factual. You have a situation where a school is operating at a certain level. You certainly introduce a quota to the school. Tell them you are to admit about 50% of your existing capacity.
Yes, what is wrong with the
What
quota?
is wrong with quota?
How do you introduce a quota, reduce the number of people who go into the school, and tell them that you are trying to increase the number of...
Yeah, but there must be a rationale for that, and it's not
But
only
what
about
is the rationale?
quality. Sometimes
No.
in the health sector, quality is far more important
Evans,
than quantity. I must admit.
It is not about quantity and quality here. We all admit that quality, and there are several quality checks. I've just told you. I am a tutor in the health institution. I'm an associate professor in the University of Ghana Medical School. We admit based on our clinical space in the clinical years, our laboratory space in the laboratory years, in the basic sciences years. So we don't just take any number, right? These nursing schools were admitting based on what they were capable of handling. The Nursing and Midwifery Council regulates how many they admit, because they go and assess you and credential you and accredit you that based on your laboratory space, you can handle this number of students.
Because I didn't finish.
Medical schools are admitted based on what the Medical and Dental Council specifies.
So you remove the quota.
We will remove the quota, and you'll be admitting
So-
based on what your regulator states that you can admit, not what the ministry thinks that they can pay
Evans,
as an allowance.
Evans, Ghanaians should be very, very careful. If they do that, the sort of people that we are going to train in this country. Medical and Dental Council regulates. Even recently, we have to sit down with them to see the numbers again. Because it's not only that you have laboratory, you have the people who will be teaching. The requisite number of qualified tutors. You have to get a clinical site. If you don't have hospitals, now I've seen places where, when I was in Konfanoche and I'd go to other hospitals, when I was the chief executive, that where about 10 or 7 nursing students following one person to the theater. That is not training. It's very important that you get training sites, clinical training sites. And I will stress it, clinical training sites for medical students. I'm coming to the numbers.
Let's come to the numbers. You said how many
The numbers,
doctors?
for example, regional hospitals, district hospitals, we put per district hospital, we need 23 medical officers. The number of hospitals, if it's 102, you have the numbers. Regional hospitals, ideally, we need 132 doctors there. Not that every doctor comes and sits in a place, a teaching hospital, where we will not get any clinical place. In a psychiatric hospital, we need at least 21 doctors per the psychiatric hospital. And if you go to nurses, I'm using doctors and nurses as a proxy. No. And then if you go to the total number of health professionals, we need 549 in the district hospitals. We did the calculation and we need 1,343 people in the regional hospitals and 947.
So you've done calculation of what the human resource you require.
We require.
Where are you getting the human resource?
That is
We
the
have
critical question.
we have enough nurses in this country.
No, to say you have enough is not
Enough
good enough
nurses.
for me.
Oh, but how many
Where?
nurses? Where? From
Yeah.
Ghana.
Yeah, but
From
specifically, are you training more? How many are you training? How many do you have? Because again, you want to commission an operation line.
Yes, have you looked at
Readily,
Readily.
where are you getting all? Because we mentioned some
No, but-
70,000 health
Yeah,
professionals.
but,
and all.
but readily, are you aware that there are nurses and doctors being trained from our medical schools and even the private?
in sufficient
Ghana.
numbers to meet the requirements that you've just
Exactly.
telling us?
Exactly.
You've done the number.
We've done our
So
homework.
so we know
We've done our
we have a
numbers.
set number of medical institutions in Ghana.
Yes.
Have you done the permutations over a period to say how many you expect out ready to go in there with the experience required to work and to fill those
Yes, we've done
spaces?
you've done the calculations.
So tell me now.
We've done the calculations. We have how many? Five public medical schools. We have also 2 private medical schools. And there are even another 2 of them also which have sprung up in Accra. And there are more coming up.
And what's the total number of medical the doctors here?
Yes, ideally, I've given you 23 per district hospital, not 1 or 2 doctors. And we are doing in such a way that, if you look in our manifesto, we have also talked about rural incentives.
Yes.
Putting this into the rural incentive document that has been there for a long time. We are talking about if you want to push somebody to a district hospital, especially rural district hospital, we need to have an accommodation for
You're giving them a cars.
Yes, we have started.
Okay.
Yes, we're going to start for the nurses. So if you do all these things, you attract people. They go there, they take their bags, and then you go and be in accommodation.
Okay, the fundamental question both of you will answer pretty quickly, and I'll come to that, is the costing and how much is it that you really want to put, and where are you going to get the money
I want to
from?
make,
Yes, you.
I want to make a
So,
conclusion.
Evans, I wanted to
conclusion.
conclude.
Let me make a conclusion.
That if anybody says that we haven't thought about human resources, the person doesn't know what he's talking about.
Right.
Evans,
Secondly, if anybody talks about abandoning hospitals, NPP government is not a hospital, it's not a government which abandons hospitals.
But you, just a second. You said you will complete your CHIPS compound, and we asked that question when we did analysis. Does it mean that the CHIPS compound that John Mahama started have been abandoned?
I will give you the data to support that. Under this government, there have been a contraction of the number of functional CHIPS compound, and I'll just give you the data for that. But let me complete the human resource bit. I think that just the figures given in human resource is staffing norms. That is the easiest aspect of it. We know by standard, if you create a hospital, how many people you need in that hospital. That's the easiest thing to state. Anybody can calculate that. The question is, how are you getting that? Right?
And where?
And where that's the question you were asking, the hard questions. And I was saying when they announced this hospital, ambitious, completion in 18 months, someone should tell us, because of this policy, we are increasing admission, or we are finding this mechanism to get people in. We are talking about not just fresh doctors coming out. We are talking about some number of specialists at each of these places, nurses and all of that. And these are the people that are also leaving. Now, when you come to retaining doctors, our policy has been very clear on healthcare workers in general. The staff motivation. We've talked about risk exposure allowance for them. We've talked about the rural or deprived area incentive package. This package is coming with an allowance on their basic salary, promotion out of term, which means that if someone working in Accra is going to be promoted in 5 years, if you agree to serve in Lambuse and you are 2 doctors there, we will promote you earlier, say 3 years. Steady leave policy is going to be revised, which means that you are entitled to go to steady leave earlier. Then it comes as a complete package to attract people to this place, which is, there's no that level of clarity in what they have stated. So these are some
But they have clarity. They told us they're going to give the vehicles to the health professionals. Right?
That tax waiver is something that both of us have captured in our manifestos. We have also stated that we're going to reintroduce it, which they have started the introduction, and the manager said that it's efficient so that people can access it. But in addition to that, these are the other things that we will give to people who agree to posting in the...
Have you looked at our manifesto?
I have studied your manifesto in detail.
You don't have any rural incentives?
I have
you don't
studied,
have any accommodation?
I've studied your manifesto in detail. I'll go ahead and answer my questions, not what you asked me, so that I can state what we want to state. Now, let me talk about the CHIPS compound issue, right? And I just give you some.
Because you also have CHIPS compound in your manifesto.
Yes.
And you say you want to complete them.
Yes.
How many? How many do you want to complete?
At the time we're leaving, we had about 1,600 that we had worked on, and about another 1,200 were at various stages that we had not completed.
So as we speak tonight, do you know how many have not been completed that you intend to complete?
So if you had allowed me, I'll give you some figures, okay? Number of functional CHIPS zones, right, in this country.
As we speak tonight.
I'm giving you some figures, right? Like from when we left office.
Yeah, but that's,
and then what
that's
it
too
is.
long ago.
No, but
That's
if you,
about 8
ask me,
years
if you
apart.
ask me as of tonight,
Yeah.
I'll need that data from government.
No, but wait. You sat down, you drafted a manifesto
Yes.
in which you said you want to complete CHIPS compound. That's based on assumption
Yes.
that there are CHIPS compounds that are not complete.
Because
to
we
put that in a
know,
manifesto.
we know
Yes.
how many were left behind.
But
And I'm
but
telling
put that
you,
in mind.
no,
must
I'm
check.
giving you some
must
figure
check.
here. Not
How
if you allow me. Like at 2016.
I know
I'm
that. I mean,
just-
that's data we
no,
know. But is it relevant
Evans, I'm giving
right
you up
now?
to
It's not.
2023. It will show you the relevance. If at 2016 we had about 4,400 CHIPS compounds functioning, right? And at the end of 2023, we are having 3,073 CHIPS compounds functioning. It means that
Where is that data from?
it means that I can share the data with you. It's here, and I can give it to you. It's from Ministry of Health. I can share it with you. So it tells you that there have been a contraction in the number of functional CHIPS compounds, right? Some have been abandoned, were not completed.
We are in 2024.
We get the annual figures at the end of the year.
Okay.
So if I give you end of year 2023,
And then you
that
also
is
say you
not
want to
wrong.
upgrade hospitals.
Yes.
Okay, so the question I asked him about staffing,
Yeah.
you also have to answer that question.
Yes.
Because if you're completing
Yes.
and you're upgrading,
Yes.
it will come with increased staffing.
Yes.
Yes.
And we've been very clear on that.
So
we have told you.
where are you? Don't tell me you
No, I'm
also
coming.
have your number.
No.
Where are you also getting? First of all,
Yeah.
how many health professionals would you require to fill the gaps that will be created when you complete and you upgrade?
Okay, when you upgrade a hospital, basically what you're going to do is infrastructure expansion. You are not building a completely new hospital that you have to staff.
Yeah, of course. But if you
But
expand the infrastructure,
wait, I'm coming.
it comes naturally with the fact that you have.
I am giving you some information. We have given you a clear path. For instance, that we want to establish a new medical school.
I know that's my question.
I'm coming.
The question is that
no, you're talking about how we are generating the human resource.
First question.
Yes.
Before I come to the how, how many spaces do you anticipate will be created when you complete the CHIPS compound and upgrade the hospitals?
So you've asked two questions, and I have to separate them.
So
Because
let's start with the CHIPS compound.
The CHIPS
When
compound.
you complete, how many spaces?
We
you
know the
anticipate?
caliber of workers that work in the CHIPS compound.
Yeah.
So if you have a CHIPS compound that has delivery services, in addition to our community health workers, you need a midwife. So the CHIPS compound, maximum, you have 3, 4 maximum.
So across the
clinical
country,
staff.
how many midwives
So,
you want?
no, normally you would have, depending on the situation, 1, 2 midwives in a CHIPS compound that is doing delivery services is fine. If you get more than that, you're happy. But then if you get like a physician assistant, then it's upgraded beyond the CHIPS compound to a health center, right? So those figures we know.
No,
so
but you haven't said it.
No,
You haven't told
I've given you per unit.
He told you that the calculations they've done
Yeah.
for district hospitals, for regional hospitals, you want to complete.
No, if you complete 1,200 CHIPS compound,
Yes.
and I've told you how much you need per unit.
Yeah, but that's
is
per
easy-
unit.
That's easy to calculate.
No, you tell me. It's not my job to calculate. You
No,
put it.
but-
You put it in your manifesto. You must
Yes.
have that data.
We have it. You
how
don't need to
many?
do that to mention it often. I'm
So,
telling you that if you-
so
if
it's
you
safe
need-
to
if
say
need-
that
if
you
need
put it
a-
in your manifesto
Yeah.
without thinking about the
No,
staffing.
we have talked about
needs
it. I've
of
just
this.
told you this.
But you tell me the number. Tell me the big
Oh.
number.
The-
And then the hospital, when you upgrade, you expand infrastructure for the existing hospital, you
Yes.
definitely will need more hands there
Yes.
to run it.
Yes.
How many people would you, again, need to, once you finish the upgrades?
So if we talk about the teaching hospital, if we take a hospital like Kolebu, we say we want to upgrade Kolebu to be like a quaternary hospital. If we are upgrading to Kolebu to be a quaternary hospital, it's new skills that you need, not necessarily bringing in a lot of new medical officers, right? If you are, Kolebu has a lot of specialized units, and Kolebu's fundamental problem is not the human resource. Kolebu has properly trained human resource. They need space and equipment to work. So if you say you are upgrading it, it means you are upgrading facilities,
Okay.
you are upgrading equipment. Where the human resource bit comes in is if there are some essential skills that they don't have, then you can. But I'm telling you that Kolebu doesn't have a problem with skill.
This is a national picture.
Yeah, so I'm just giving you, because we've mentioned specific hospitals. So if you allow me, I'll give you. We've talked about Kolebu. We've talked about
But that's not my question. My question is, we know the hospitals in your manifesto.
Yes.
What is in your manifesto, which is the point of this show,
Yeah.
is to now tell us where, the same question.
Yes,
Same question.
I agree.
Where are you, how many, and where are you getting them from?
See, if you allow me, I told you that.
But I have allowed
No, I'm just saying, if you talk about where are we getting them from.
How many first? You haven't told me how many. You didn't
For the
tell me for
Chiefs
Chiefs
compound.
You said you have
For the Chiefs
unit.
compound. For the Chiefs compound. I've told you
There are
that.
hospitals?
For the Chiefs compound, if you do the analysis, what is in here, we are looking about 3,600 community health workers.
Okay, but you want to get, and then
Four,
if you upgrade the hospitals and you need more hands to now fully run it, how many are looking?
Many of our hospitals, like Kolebu, are adequately staffed, if not overstaffed.
Okay, I want to take a pause on that.
So my point is that to achieve this, Evans, I think the point I've been trying to make is that you have to realize that there is an input. And that input is that from the basic training. So if you are generating this amount, you need this amount of new nurses to man Chiefs compound. It means that you must grant access to admission.
Let me ask a fundamental question.
You must grant access to admission.
Both of you. Dr. says to you first. How much is it going to cost you to fully implement your manifesto? CDD, Kwame Sapansedu, who was here a short while ago, said it will cost you some $13 billion in 4 years to implement. You don't dispute that?
No, I asked him a question.
Okay.
Where did he get, what is the basis of his calculation?
You dispute it?
Yes, when he came to us.
You dispute it?
I asked him a very simple question.
Okay, so if you dispute
what is the basis of your calculation?
He actually explained it. He explained it in this when he said, well, you dispute it?
No, how do you, I don't see where he got his figures.
Okay.
Because you see, you have to get the basis.
What is yours?
Before,
what is your figure? How much is it going to cost you?
Before you can then say what he said.
Okay, you did the manifesto. How much is it going to cost you to implement
You know how much it costs. We know how much it costs.
So tell us.
The source of money for Agenda 1.
I haven't asked the source yet. I'm asking about how much.
Agenda 111.
Not Agenda 111. I'm talking about all your promises.
All the things that you are doing. If you read our manifesto very well, I can see that you've left a lot of portions out. If you look at it, it will tell you how we are going to do these things. One, you know that our flag bearer has said.
But you don't answer my question.
I'm coming. You want me to give you a figure?
Yes.
I have not done that calculation that CEO has done. I don't know his basis.
So you have questions there, but I'm asking you yours.
Yes.
Because you put 52 promises in your manifesto as far as health is concerned.
Which we know within the 4 years.
Did you cost it?
Yes, we are costing our manifesto.
You are costing or you've costed?
We've costed, we know how much it is.
So how much is it going to cost you to deliver on all 52 promises?
I cannot give you a figure today.
So you don't have it?
We have it. I can give you a figure the next.
But you are the spokesperson.
Yes, I'll give you a figure. But what I'm saying is that I know what you are doing. Fixing that, how much
because
it's going to cost.
You don't disagree that it is the most important question considering where the economy is going to be in 2025.
Yes.
So answer the question.
And you know where the economy will be in 2025. We've also told you in our manifesto how we are going to solve a lot of the problems that we have put in our
Yeah, that's not my question.
Should
I assume that you don't have the
private
cost?
sector will take a very active role in whatever we are doing. For example, in placement of equipment, in even managing some of the hospitals.
That's sorry, you have not costed your manifesto.
We've costed the manifesto.
So how much is it going to cost
the manifesto? I don't have the figure offhand here to tell you.
Okay.
Next time I come here, I'll give you the figure.
Okay.
Because I don't want to do any calculation which I tell you something that I don't have any basis.
So you don't have it. That's although the manifesto has been done and launched.
We have the manifesto. We have the figure.
Okay.
But I have not invested.
Let me ask him that and I'll come back to you.
So when I'll get it and come here again and give you.
We'll do it again, definitely. What's you have 111.
Well, I don't know the basis
quantity.
Of your 111.
It's simple count.
No.
This is simple count. But that's not my question. My question is, how much, what's the cost of that?
Well, so I have costs per each of the major significant things that we wish to do.
And that total is what?
No, I'm not going to be able to give you a RAM total.
So you also haven't cost.
No, I'm just telling you. I mean, why do you jump to that conclusion? I said I have
so it's
cost.
simple.
So if you allow me, I'll tell you. So for instance, if you take our free primary healthcare policy,
Okay.
we estimate per annum is going to cost us about $49 million. Right? And we've costed this because we've done estimation for the number, because we are doing it in phases. We've costed that if we have about 6,000 chips compound operating. Right now we're around 4,000. If we complete what we wish to complete and have all the chips compound running, we'll have roughly about 6,000. We've costed that, how much expenditure it costs per chips compound per year. And so if we are freeing funds for them and they are going to get, it's going to cost about $49 million.
$49 million
Per annum.
per annum for the free primary healthcare.
Yes.
$49 million.
Yes.
Okay, so that's just one item.
That's one item. So I'm telling you that, you see,
One item
Evans,
of
the kind of
111.
questions you're asking, if you want someone to just mention a figure to you, remember, we have to give you some
But we have
details.
something. You have the benchmark there.
We have to give you
he's
some
told you it's
details.
18 billion.
Yeah, but I don't.
$18 billion.
On the basis of what? So I asked him a question. You see,
What's the basis?
You are making an assumption that as if there's no ongoing expenditure. He does the calculation without any subtractions. So if you calculate that per capita, we need this amount, and therefore this is how much we are spending. And this promise,
The reason why,
is
the
not
reason
in
why I
vacuum.
won't accept your questioning of the figure is because you haven't produced any.
But I'm giving you figures.
Yeah, but
No, you just told me
but-
one
but-
line item.
No, but
I'm
it's
talking
because
about
you-
the entire manifesto.
Yeah, but you don't throw,
I'm just
you don't
telling
throw
you
out
that
the figure and
don't
let people
throw out
come-
figures
come
without
and- come and-
explanation.
come
No,
and-
but
Evans,
he's done
that
calculations
is going to be
based on
sensational.
grounded facts. It's not
No.
sensational.
No, it's a
We need
sensational
to-
Because you don't have any
No.
facts
No,
to contradict
please.
that.
Evans, I don't think it's fair to say.
I also,
On two-
I don't think it's
I don't
fair.
agree
So,
with
for
you.
instance, we talked
don't
about
agree.
a 500 capacity fertility specialist hospital. We estimate it's going to cost about $260 to about $280 million. We've costed everything.
No, but you haven't costed
So,
everything.
we
You've
have.
costed some of your
I am
promise.
just telling you that what I will not do is to give you an overall figure without details.
But you said you've costed everything.
Yeah, if you give
You haven't
me
costed everything, so tell me.
some aspect of it is not monetary. So there are some aspects of the manifesto that's not monetary.
So let me ask a
because the
different
ones that are
question.
capital in
Let me
nature.
ask a different question that both of you should be able to answer. All of you met the various health professionals, and they
Yes.
were on the show when we're doing it. And they said
Yes.
when they came to your company, they told you you increase your budgetary allocation
Yes.
to the health sector.
Yes.
In fact, the Abuja declaration said 15%.
Yeah.
How much are you dedicating to health, Dr. Nsari, in the next 4 years if you win?
We are working towards the Abuja Declaration.
No, how much?
We are
It's
working
15%.
towards the Abuja Declaration.
15%.
You see, and the 15% that
So you would.
Declaration-
I need clarity on this. This is so important, right?
We-
So from 2025 to
we work
2028,
assiduously towards
the new MPP government
We work
will
assiduously.
allocate 15% of the national budget to health.
we will work assiduously towards the 15%.
But you've been working.
We have been increasing our percentage GDP over a period of time. Are you aware of that? And we are going to work assiduously towards that. You remember I was telling something that the flag bearer said that we will cede off 3% of our GDP to the private sector. What we don't do in health in Ghana is that we don't involve the private sector to be very much involved in our healthcare system. Elsewhere, the private sector is a very important aspect of healthcare. For example, I'll give you an example. If you look at the total number of health professionals in this country, you see maybe doctors and nurses as a proxy. The amount of health professionals that the private sector employs is only 1%. 99% of them are employed and paid by government. So the private sector participation in health is a bit weak. So we have, if you look at our manifesto, we've put in a lot of things in the manifesto where we are going to work closely together with private sector. For example, the accommodation which I term as medical villages for hospitals, where they will have everything so that the person who has gone there, there's a nursery, there's a commercial area, there's a playground, there's an amusement center, there's even a school. There's accommodation where he moves in. If he's in a rural area, he doesn't pay it, it's added to the salary. And then also the other incentives like deprived area incentives and all these things will be done. The private sector is the one who will be taking care of that.
No problem. So again, come to the question.
So,
how much of what's the budget allocation that you're committing for the next 4 years to the health?
you have asked that question. I said
But
that-
you said
I said
Abuja
that-
declaration. You're working
I said that we
towards.
will work assiduously towards.
Towards.
declaration.
Yeah, which is 15%. And I keep asking that. So you are committing 15% over the next 4 years?
We will work assiduously towards that.
Okay.
So that we attain.
By what time do you want to attain 15%? If you win the next 4 years?
I'll be very happy that by the 4 years that maybe you have attained 15%.
That doesn't answer the question.
No, you are asking a question as if, tell me this.
No, but that is how you measure the effectiveness of any document.
So what is going to
and you don't
happen,
have that. You haven't.
We haven't.
About it. Okay. But Title, same question to you. You know that question was coming. Well, if you haven't done it, then we are questioning how responsive your manifesto is.
So we have decided that to finance a lot of the things we've talked about in health, private sector participation is needed, but we have decided that one of the fundamental things to do is to uncap the NHIS, make funds available, and we are allocating, for instance, 20% of our NHIS funds.
But that doesn't answer the question. That doesn't answer the question.
That's coming in to our primary healthcare policy. Yeah. So we've brought in funding mechanisms for the various aspects of it, which I didn't have the opportunity to talk about because I've given you a figure, but I've not told how we intend to raise that money. Right? That's why I'm answering that. So I'm backtracking a bit to give you how we.
But I haven't answered my question.
No, I'll get to that. But I need to give you. You see, that's why we don't like throwing figures in isolation. When you give you a figure, we should be able to tell you how we intend to raise it.
So give me the figure and then tell me how you intend to raise it.
That's what I was
haven't given me the figure.
No,
I'm talking about percentage, in fact.
No, I was just giving. I'm saying I'm answering back the question you asked on our private healthcare policy. I gave you a figure and I was telling you how we intend to raise that.
Yeah, but I'm not asking a question
about. But now going to your question on the percentage GDP.
Yes.
Yes. That is something, if you look at our previous expenditure lines, we have tried our very best to get to that Abuja declaration, right? I can't sit here and commit to you that by next year we will be doing 15% or 16%. No.
So when you were planning the manifesto, what percentage do you have in mind you had to devote to the cause of health to achieve what you put in there? You must have a picture.
I can't give you a figure now.
Okay. This is why we do Manifesto Tracker. We need to have this conversation again, gentlemen.
Yeah.
Because that's what people then begin to come to a conclusion on what is feasible and what is not. I'm grateful that you joined us both. And I think you've expanded on your manifesto promises adequately. Thank you very much. Enjoy the rest of your evening.